You're listening to an African Elements top news story for June 30th, 2025. Please visit our website at africanelements.org for more daily news. The Big Beautiful Bill, A Reckoning for Black Communities, by Darius Spearman. The One Big Beautiful Bill Act, often called the Big Beautiful Bill or OBBB, is a proposed budget reconciliation bill currently making its way through the 119th United States Congress. This legislation is not just another piece of policy. It represents a sweeping overhaul of federal spending and taxation, with profound implications for every American, especially those in vulnerable communities. A budget reconciliation bill is a special legislative tool that allows certain budget-related measures to pass the Senate with a simple majority vote, bypassing the usual 60-vote threshold needed to overcome a filibuster. This means it can be pushed through with less bipartisan support, making its passage potentially easier for the majority party. The core of this bill involves extending significant portions of the 2017 Tax Cuts and Jobs Act, which are set to expire at the close of 2025. In addition to these extensions, the OBBB introduces new tax breaks, such as eliminating taxes on tips, overtime, and Social Security income through 2028. These tax cuts alone total an estimated $3.75 trillion. To offset this massive revenue loss, the bill proposes deep cuts to non-military government spending, particularly targeting essential social programs like Medicaid and the Supplemental Nutrition Assistance Program. It also allocates an extra $150 billion for defense spending, scales back many clean energy tax credits from the Inflation Reduction Act, and even introduces new taxes on solar and wind energy while providing tax breaks for the coal and oil industries. The financial implications of the Big Beautiful Bill are a central point of contention. The Congressional Budget Office has released sobering projections. According to the CBO, the OBBB could add a staggering $2.4 trillion to the national debt over the next decade. This projection stands in stark contrast to claims that the tax cuts will stimulate economic growth and ultimately increase government revenues. Analyses suggest that the extension of these tax benefits under the OBBB would primarily benefit top earners, further widening the economic gap. The proposed cuts to Medicaid are particularly alarming, representing the largest reductions to the program since its creation in 1965. The bill introduces new work and verification requirements for Medicaid enrollees. These requirements mandate that able-bodied adults without dependents must engage in work, job training, or community service for a certain number of hours each week to maintain their eligibility. Verification requirements would involve stricter processes for proving income, residency, and other qualifying factors. These changes differ significantly from current Medicaid rules in many states. The human cost of these changes is projected to be immense. The CBO estimates that approximately 10.9 million people could lose health coverage over the next decade due to cuts to Medicaid and reduced subsidies for marketplace plans. This includes an estimated 7.8 million people losing access to Medicaid alone. When combined with 5.1 million people already projected to lose coverage due to the expiration of enhanced premium tax credits at the end of 2025, the total potential loss of health coverage could reach approximately 16 million nationwide. The loss of health insurance is directly correlated with adverse health outcomes, meaning these policy changes could exacerbate existing health disparities. Many hospitals, especially those in rural areas and those serving disadvantaged groups, rely on Medicaid revenues for their operations. Cutting this funding could force hospitals to cut staff, reduce services, or even close, further eroding the healthcare infrastructure. Beyond healthcare, the bill proposes significant cuts and changes to SNAP, which provides crucial food assistance to low-income individuals and families. Stricter eligibility requirements for SNAP would likely mean that fewer people qualify for benefits or that benefits themselves would be reduced for current recipients. These changes are expected to increase food insecurity, particularly for the lowest income quintile of Americans who would see a reduction in their net resources by an average of $940. The bill also includes changes to higher education that would make college more expensive and limit student aid. Making college harder to afford could limit opportunities and perpetuate cycles of economic disadvantage. The bill proposes scaling back many of the clean energy tax credits established by the Inflation Reduction Act. It also includes provisions for repealing and modifying those energy tax provisions. This would likely disincentivize investment in renewable energy and slow the transition to a cleaner energy grid while providing tax breaks for coal and oil industries. Despite a strong push for a July 4th deadline, the legislation faces significant opposition and internal divisions within the Republican Party. The bill narrowly passed the House in May, but some GOP members have expressed regret and called for its removal. There is hesitation among some Republicans to support Medicare cuts given the reliance of many elderly supporters on the program. In the Senate, procedural votes were delayed as Republicans worked out details, eventually passing by a narrow margin. 2 Republicans joined all Democrats in opposition. Critics have not minced words. Senator Chuck Schumer dubbed it the "Well, We're All Going to Die Act." Senator Bernie Sanders called it the most dangerous piece of legislation in modern U.S. history, a gift to the billionaire class and a reflection of a corrupt campaign finance system. The Big Beautiful Bill stands as a stark example of legislative priorities that could reshape the American landscape for decades to come. Its blend of massive tax cuts for the wealthy and deep reductions in crucial social safety nets presents a challenging future for many, particularly for Black communities who often bear the brunt of such policy shifts. The ongoing debate in Congress underscores the high stakes involved. The potential impacts on healthcare access, food security, educational opportunities, and environmental sustainability remain at the forefront of national concern. The outcome of this legislative battle will have profound and lasting consequences for the well-being of millions of Americans. Copyright African Elements.